You know, the chest X-ray, it's one of the most common medical images on the planet. But for most of us, it's just a mystery, a bunch of black and white shadows. But what if I told you that hidden in those shadows is a precise language, a story about what's happening inside our bodies? Well, let's dive in and figure out how to decode that story step by step.
So this is where it all begins, a standard, normal chest X-ray. Think of it like a 2D map of a 3D space, with all these structures layered on top of each other. You've got the lungs, the heart, the ribs, the spine, and they're all just represented by different shades of gray.
It kind of seems impossible, doesn't it? I mean, how can anyone possibly look at this and spot some tiny, potentially life-threatening issue? Well, here's the secret. It's not magic, it's a method. It's a systematic approach that turns this seemingly chaotic image into a really clear set of clues. And that is exactly what we're going to break down.
Okay, so before you can even start reading the map, you got to make sure you have the right one. The very first step in solving this puzzle is understanding how the picture is taken, because believe me, the angle of that X-ray beam, it changes everything. This right here is the PA view, postero-anterior, and it is the absolute gold standard. So the patient stands with their chest up against the film and the X-ray beam shoots from their back to their front. And the reason for this is actually pretty simple physics. By keeping the heart as close to the film as possible, you stop its shadow from getting magnified. This gives doctors a much more accurate look at its true size.
And wow, you can really see the difference here. On the left, you've got that nice, clear PA view we just talked about. But on the right, that's an AP, or anterior-posterior view. This is often what they have to use for patients who are too sick to stand up. The beam goes from front to back, which puts the heart farther from the film. And look what happens. The heart's shadow looks way bigger than it actually is, which could easily lead to a misdiagnosis. It just makes the whole thing a lot trickier to interpret.
Of course, a single view isn't going to solve every mystery. So doctors have a few other tricks up their sleeve. A lateral view, taken from the side, lets them peek behind the heart. An expiratory view, where you breathe out, can reveal a tiny collapsed lung that might otherwise be hidden. And a decubitus view, where the patient lies on their side, uses good old gravity to check for any fluid sloshing around in the chest. Each one is a specialized tool for a very specific job. So, you've got the right picture. Now what? You can't just randomly scan it, hoping to find a problem. You'd miss things all the time. This is where the real secret comes in. A systematic checklist that makes sure nothing, and I mean nothing, gets overlooked.
The key to it all is a mnemonic. It's just a simple memory aid that forces the person reading the X-ray to look at every single area in a very specific order. It's this discipline that separates a wild guess from an actual diagnosis. It's all about building a reliable habit so you can catch even the most subtle little clues.
And here's one of the most common ones. It's called MDPLTS. Think of it as a guided tour that takes you through the entire image. You start in the middle with M for the mediastinum, then you go down to D, the diaphragm, out to the edges for P, the pleura, then L, the lungs themselves. O is for osseous structures, which is just a fancy word for bones. Then you jump back to T for the trachea, and you finish up with S for all the surrounding soft tissues. It's the full tour, every single time, no exceptions.
All right, we have the framework. Theory's great, but let's see this thing in action. We're going to use this systematic approach to spot some of the most common and critical things a doctor might find.
Okay, let's start with a little compare and contrast. On the left, that's our normal baseline. Now let's apply our checklist to the image on the right. When we get to P for pleura, whoa. Look at the bottom of that right lung. That huge white area, that's a pleural effusion. It's fluid that's collected in the space around the lung, and it's completely blotting out that sharp corner of the diaphragm you can see so clearly on the normal X-ray.
Sticking with P for pleura, let's check out another big problem. On the right, that's a pneumothorax, a collapsed lung. Basically, air has leaked into that pleural space, breaking the natural seal. If you follow those arrows, you can just make out the thin white edge of the lung itself. See how it's pulled away from the chest wall? That dark area outside that line, that's not lung tissue anymore. It's just air where it shouldn't be.
Okay, let's move on to M for mediastinum, where we can check out the heart. The image on the right shows some classic signs of congestive heart failure. First off, the heart shadow is way bigger compared to the normal one on the left. And see how the lung markings look kind of hazy and blurry? That's called vascular congestion, and it's another huge sign that the heart just isn't pumping like it should be.
Now for L in our checklist, the lungs themselves.
The source material uses this fantastic analogy for the lung's internal scaffolding, something called the interstitium. It's described as being like the highways, streets, and alleys of a city. And when that city grid gets all inflamed and clogged up, well, the whole city has a major problem. And this is exactly what that looks like. This is interstitial lung disease. Instead of the lungs being filled with nice, clear black air, that structural grid, those highways and alleys, has become thickened and inflamed. It creates this diffuse kind of web-like pattern all over the lungs, and that makes it a whole lot harder for them to do their job. You know, this whole systematic approach doesn't just stop with reading the image. To remember all the different things that could cause a condition like this, doctors use mnemonics here too. It's just another layer of the method, another tool to help them navigate a really complex diagnosis.
But here's the thing. As powerful as the chest X-ray is, it doesn't always have all the answers. Sometimes it's great at finding a problem, but it can't tell you exactly what that problem is. And that's when you have to call for backup and look a little deeper.
Take a look at this. The MDPLET system would help you spot this abnormal white shadow at the top of the mediastinum pretty fast. So the X-ray is telling us, hey, something is here that shouldn't be. But what is it? Is it dangerous? The X-ray, well, it can't give us the final answer. It's just posed a brand new question.
And here's the answer. A CT scan of the same patient gives us this amazing cross-sectional view, almost like looking at a single slice of the body. And now the picture is perfectly clear. The arrow points right to the mass, and you can see it's actually connected to the thyroid gland. Mystery solved.
So I think the big thing to take away from this is how these tools all work together. The chest X-ray is like the quick, effective scout. It's the first one in to survey the landscape and identify any areas of concern. But when it finds something that needs a much closer look, that's when you call in the special forces, the CTD MRI, the PET scans, to get the super detailed intelligence you need for a final diagnosis. It's really amazing when you think about it. From a simple collection of shadows to this incredibly detailed diagnostic tool, the chest X-ray is just a testament to methodical, systematic observation. It reveals these incredible secrets about how our bodies work. And it just makes you wonder, with all the advances in technology and AI, what other hidden details will we be able to see tomorrow?